Put your hands together for that. The recap of day one, amen, starting at the Capitol and with the ribbon cutting, and then last night we had our celebration service. We haven't said this much, but did you know that Sacramento is chapter of the year? Come on now. Right, of NAN, and that got like 140 chapters or so across the nation, and little bit old NAN Sacramento. We made chapter of the year. We are excited and happy, glad about that. One of the most important issues, I believe, in our time is healthcare, the state of access to good quality healthcare, especially in the African American community. Amen. Amen. And so we could not talk about have a Bridging the Divide conference without addressing this critical issue. So I called up my friend, Wim Jamal Miller, who is no stranger to us over here at Genesis Church. And I asked for his help to put together a panel of experts and who are in their field to come and speak to us about this very important issue. And I'll tell you, he came through. He couldn't be here today, but can we just give it up for my friend, William Jamal Miller? He works for the Mercy Medical Group there, and they are presenting this panel. I'm going to let them introduce themselves, but this panel will be moderated by none other than Rhonda Smith, who is the Executive Director of California Black Health Network. And we know the California Black Health Network has been on the grounds doing some great work throughout California, the state. And we are excited for it to have all of these wonderful persons here, taking time out of their busy schedules, because we know it is busy. Wait till you hear their resumes, and you'll be like, ooh, ah. So take pictures now. This is going to be a great panel. And I want you to put your hands together for Dr. Rhonda Smith as she comes right now.
So thank you all for the opportunity to be here today to talk about an important subject, and this is something that I live with every day. As the Executive Director of the California Black Health Network, we focus on advancing health equity for Black Californians across the state, and what that means is that we work to prevent our folks from dying from stuff they shouldn't be dying from. A lot of chronic diseases that our community suffers from are preventable, and we do our part to make sure that our community knows how to advocate for themselves, which we'll talk about from the panel, how important that is to really make the healthcare system work better for us. And we'll talk about some of the issues and barriers that exist and how we can overcome them as we are trying to take care of our health and well-being on our own. And so before I turn it over for the panelists to introduce themselves, I just want to take a few minutes to set the stage. And so when we talk about the state of Black health, when we look at life expectancy here in this country, we live about 6 years less than our white counterparts. In California, it's about 5.5 years less compared to the state average. When we look at the white and Asian population, that's about 7 years, and then 10 years when we look at the AAPI community. When we think about everything from birth to death, we're at the top of every list, and not necessarily in a good way. When we look at maternal health, we know that Black women die more often, or I should say Black birthing people die more often during childbirth than their white counterparts. We know that Black babies are 2 times more likely to die in childbirth and 3 times more likely to die when they're cared for by a white healthcare provider, unfortunately. And we know that Black children are 2 times more likely to suffer from food insecurity than their white counterparts. So we got a lot of work to do, right? But I believe if we all work together, that we can come together and have more power in solving our own problems related to our health and well-being. And so the other thing that I think is important to address is, well, I always call the big elephant in the room, but thanks to COVID, we can now talk a lot more about the impact of racism on the health and well-being of Black and brown communities. And so we're very fortunate to work with the California Healthcare Foundation to implement some of the recommendations that came out of their Listening to Black Californians research report. And one of the key things that I guess is no big news, is that 1 out of 3 Black Californians report experiencing racism or discrimination when they're working with their healthcare provider or navigating through the healthcare system. Now, I don't have any solutions on how to eradicate racism, but I think there's some things that we can do to become more empowered to know how to mitigate that when we're confronted while we're dealing with the healthcare system. And so we'll talk all about all these things today. And before we get into the meat of our conversation, I would like for each of the panelists to introduce themselves and kind of talk about who they are, where they work, and one important note. So just take a minute to tell us who you are and a little bit about yourself.
Sure. My name is Keith Jones. I'm a vascular surgeon at Mercy Medical Group. I've been in practice over 10 years now, originally from Memphis, Tennessee. Vascular conditions that I treat range anywhere from dialysis, access to fixing carotid disease in patients that present with strokes, aneurysm disease, lower extremity disease, which could include angioplasty, stenting, bypasses in patients that may be at risk of amputation or limb loss. So we treat basically the whole range of vascular disease, and I'm glad to be here this morning. Thanks.
Thank you. Christina.
Good afternoon, everyone. Such a pleasure to be here. My name is Christina Van Donk. I'm a native San Franciscan. I live and work in the San Francisco Bay Area. I work for Kaiser Permanente in Oakland, and I've been there 16 years. I currently lead our Thought Leadership Program. I can tell you that Kaiser Permanente has been committed to the work of uncovering health disparities and advancing work in the health equity space for decades. It's something that's literally in our DNA. It's part of who we are as an organization and part of our mission. Now, having said that, I am actually here to talk to you today about my experience as a woman, a Black woman, in the healthcare system, as someone who lives with active cancer. And so despite the disparities that exist, I want to share a little bit with you today about what I've learned and some of the things that I think we can do to do better by the communities that we serve. Thank you.
Thank you, Christina. Dawnte?
Hello, everyone. Good afternoon. My name is Dr. Dawnte Early. I am President and CEO of your local United Way California Capital Region. We are 100 years old. We celebrated our 100-year anniversary last year. We serve 5 counties, Yolo, Sacramento, Placer, Amador, and El Dorado County, and our mission is to end poverty through investing in children's education. Education is the ladder out of poverty. We, in addition to being a thought partner and what we like to call an activator and intermediary, we also provide many direct services ranging from birth, providing books to every kiddo, 0 to 5, all the way to launching the first guaranteed income program in the Sacramento region. We actually just launched another one in partnership with Sac State yesterday with former foster youth, largest free tax preparation program in across the 5 counties, as well as we provide housing supports, first, last month's rent, all of the things. In addition to this role in which we provide services to the 5-county region, I also wear another hat in which I am Mayor Pro Tem for the city of West Sacramento. That is our neighboring city here to Sacramento. I am the first Black person, not Black woman, but Black person, to be elected to city council in West Sacramento in 2021.
Thank you. And Anita?
Good afternoon. My name's Dr. Anita Maldonado, and I currently serve as new executive director at Sacramento Employment and Training Agency. I'm a native Ohioan. I've been in Northern California for 7 years, currently living in Sonoma County, but looking to come over to the Sacramento region here in the next couple of months. SETA is a joint powers agency established in 1978 with both the city and the county of Sacramento, and we administer publicly funded programs in the areas of workforce development, family-focused child development services, refugee services, and emergency assistance to over 50,000 low-income residents. SETA also serves as the Head Start Early Head Start grantee for Sacramento, and in total, SETA and its partner agencies, we serve over 4,400 children.
Thank you. And so one last thing I want to say before we get into the questions is that, we do this work every day within a healthcare system that is already broken. So it makes the work that we do even more challenging. And when you're trying to advocate for yourself and navigate, even more so. So even though we claim to be the richest nation in the world, we spend the most per capita on healthcare with the worst outcomes. We have the worst life expectancy of any developed nation in the whole world. We spend more on hospitalization. Despite all of that, we still have the worst outcomes. So, how do we fix this problem, right, in a system that's already broken? Again, I don't have the golden answer to that, but hopefully we can have some insight from what we hear today. So I would like to start with you, Christina. You have an amazing story, and really want to hear about how you were able to really advocate and navigate through the healthcare system with a very serious cancer diagnosis.
Yes, thank you so much. I'm happy to share. So I'm going to take us back to 2011. I was working for Kaiser Permanente, and I was doing the most amazing work in the space of health equity. I was the national leader for communications for community health, our national health policy, national research divisions, and national diversity. So as you can imagine, it was a very intense workload. I was traveling constantly and was very stressed. I, on the other hand, enjoyed the work immensely. It was probably the most rewarding work that I've ever done in my life, because we serve over 2 million members across this nation, and we invest over $2 billion in community programs every year across the country. So to be a part of something like that felt like ministry, literally. What was happening in the background was that I was very, very sick. I had been sick for 12 long months. I was in and out of doctor's offices every month. I had been to the ER room literally almost every other month for 12 months. My symptoms included severe back pain on my lower left side, nausea, uncontrollable weight loss, extreme fatigue, the inability to do things like move my bowels. It was bad. And I was misdiagnosed for a year. And unfortunately, a lot of times I just didn't feel heard. I didn't feel like I was being taken seriously. And I started changing doctors. And I still didn't feel like I was being heard. Unfortunately, after 12 months of that, in August of 2011, I was diagnosed with terminal stage 4 pancreatic cancer. I was given 3 to 6 months to live. I was provided with no treatment options. I was told that I would be moved to hospice, which is where they send you to make you comfortable right before you die. But God. Almost 13 years later, I'm still here. And I am still in the fight. I go to treatment. I take immunotherapy every 6 weeks. I'm in treatment. I have treatment next week. I'll tell you that I learned a lot, and I want to share because I don't want anyone to go through what I've been through navigating our healthcare system. I learned that you have to advocate for yourself. I don't know where the strength came from or the will other than God, and a very supportive husband and family and coworkers that really helped me to escalate. But I had to do that. I had to escalate to the highest levels of the organization. I had to demand that I be treated seriously and that my condition, that I be provided with options. I wouldn't accept go to hospice and die. I'm like, there's got to be something that can be done. I was blessed with an angel oncologist who surprised me, and he's here in the audience today in that white shirt. I almost broke down crying when he walked in.
Who's that? Can you
That's
stand up
Dr.
for me?
Brennan.
That's okay.
That's my doctor. He's retired now, having fun and teaching and golfing and all those things, but God really did send him to help save my life. And he said something that I'll never forget. He said, you know what? We're going to treat your cancer like we treat any other disease, any other chronic disease, whether it's heart disease, asthma, diabetes. We're going to take it one step at a time, and we're going to do the medication, and you're going to do your part, and I'm going to support you. And that's really what I needed to hear. It was just a tiny bit of hope. And I told Dr. Grinnan once, he was speaking before a whole conference of hundreds of doctors. He said, Christina, what should I tell them? I said, you tell these oncologists to treat people as human beings, as people and not as a number. That you can lead as a physician both from the head, obviously, but also from the heart. But how do we get seen as Black people in America as humans? How do we get viewed through the heart? And I think that part of that is teaching and empowering our communities to be better advocates for themselves, having conversations like we're having here today, elevating voices, different perspectives and expertise, and then getting that word out more broadly. How do you navigate a very nuanced healthcare system? What does advocacy actually look like? And I also think there is another component that maybe we don't talk about enough, and it's, I feel, part of the landscape, and that's self-accountability. We've got to do our part. The doctor can do their part, but we've got to do our part. Nutrition matters. Exercise matters, right? Lifestyle matters. Having community matters. Loneliness and isolation has been a huge thing. Mental health has been a huge thing. So we've got to approach this from a multifaceted approach, bringing in experts, having the actual physicians on the panel, the actual community leaders, and even people like me that can tell you, just because you get a diagnosis, you have to obviously acknowledge that, but you don't have to receive death. You can fight for yourself, you can advocate for yourself, and you can choose to live. That's just what I've chosen to do, live. I will not stop sharing my voice for as long as I live. And yeah, we could talk for another hour, but we've got some other voices to get to. But that's my story.
Thank you so much for sharing your story. And I think we'll talk a little bit more later, but I think there's a lot of lessons in what Christina just shared with us. So first of all, don't take no for an answer as part of advocating for yourself. And sometimes, doctors don't always know what is best for you. And I think the other thing too is finding the right partner, the right provider partner who's going to be your advocate, who's going to care about you and for you and fight for you. I think your doctor here is very rare, unfortunately, but there are opportunities to find the right healthcare provider in your situation that works for you. So you can always get a second or third opinion until you find that right person. So
I've had to fire a lot of doctors.
Yes, I did the same thing for my mom too when she was going through her health issue. And so I think I would like to go from the patient side to the provider side. So Keith, or can I call you Keith? Is
Absolutely.
that okay? Okay. So you are a vascular surgeon. First of all, talk a little bit about what that is, and then from a provider side of things, what do you see as some of the challenges or barriers that patients face, and how do you deal with that? And especially trying to take care of the whole person as part of the process.
Sure. So vascular is a specialty of its own, where we specifically deal with all the blood vessels throughout the body. As a vascular surgeon, I basically operate on any vessel below the head, below the neck, and outside the heart. And a lot of times we deal with patients that, have a lot of comorbidities, a lot of medical issues. Typically, at least what they say in the hospitals, we tend to treat the sickest patients. And a lot of times we deal with patients that have lots of chronic disease, coronary artery disease, heart attacks, strokes, diabetes. And a lot of those conditions lead to deterioration of arteries, clogging of arteries. And as you know, the arteries are the blood supply to the organs. And if you don't have an adequate blood supply, then those organs can fail, or in some instances can die. So my job is to do what I can to try to preserve the blood supply to those organs and extremities in order to prevent organ failure or limb loss in the most extreme cases. As a vascular surgeon, I would say probably the most frustrating thing that I see with my patients is a lot of my patients, by the time they arrive to my office, have been misdiagnosed, undertreated. In some cases, they've been overtreated by physicians who see the patients as dollar signs. And so, they'll tell them you have this, that, and the other. They'll set them up for multiple procedures, stents, angioplasties. And soon as they have exhausted all of those avenues, then they'll send them to me where, by that time, I don't have a whole lot of options to offer the patient. I would say one of the situations that has sort of stuck out in my mind in my 10 years of practice is there was a 17-year-old kid. This was in Florida. He was playing football, and he ended up with what we call a posterior knee dislocation. So basically, instead of the knee bending the normal way, it goes in the opposite direction. And basically injured the artery that supplies the lower leg. And he presented to one of the local hospitals. And instead of, obviously when he showed up, he didn't have a pulse in the foot, so he needed emergent surgery. But instead of them looking for a person to do a bypass or place a stent, they just cut his leg off. And 17 years old, and it was just very frustrating because you just pick up the phone and say, hey, do you guys have services in another hospital that can potentially take care of this young man? And that wasn't done. And unfortunately, you see this most often than not, at least in my practice, rather than do the hard work and do everything you can to save a limb or save a life, the easiest thing is either just to cut the leg off or don't do anything at all. But as was mentioned earlier, I think a lot of that falls on the physician, but as was mentioned, the patient has a responsibility as well. A lot of my patients are chronic smokers. They don't check their blood sugars. They eat whatever they want. They don't exercise. So I think in order to improve some of these outcomes, it is definitely a combined approach with a physician that cares and is engaged, but also the patient has to be engaged in their condition as well.
Yes, so a lot of what we try to do through our health education is help people understand how they can really be more proactive and take care of themselves better and prevent some of these chronic diseases from happening. We know that the Black community suffers more from hypertension and cardiovascular disease than most other populations, but those are things that are preventable. So we know nutrition, physical activity, and lifestyle management are all things that we have the power to control and make choices around. So let's try to be a little more proactive about how we're treating ourselves and caring for ourselves as part of that process. And so I want to talk to, or have Dawnte talk, because when we talk about nutrition and physical activity, that a lot of that is related to social determinants of health. And we know that a lot of times our zip code, unfortunately, is an indicator of our life expectancy, along with quality of life, but definitely life expectancy, but it should not be that way. So can you talk about what the United Way is doing locally here as well as nationally, if you want to share that too, about addressing social determinants of health and making sure that our children are set up to live a long, healthy life?
Absolutely. So just a few things. One, thank you for sharing your story. I could not help but tear up because I have a colleague who's literally currently going through this right now, and so just inspired to see you. It gives me hope, and I will share that hope with her as well. From the United Way side and social determinants of health, I think it's really important when we are talking about just the environment and our ability to be able to get out in a safe environment and walk to, right, have walkable streets and have parks. I oftentimes, when we say let's go back to COVID. And what we had available to us in regards to just getting outside. I am very fortunate. I live in a neighborhood and a community that has many, many trails, huge, wide streets in which you can walk in the middle of the street and a car could still drive past you and there'd be more than enough room. We have sidewalks, all the things. We have parks that are well maintained. And so when I think about getting out, exercising, having food, healthy food that is easily accessible to us, all of those things are really important. And again, it's not that the onus and the responsibility is not on us, but how much harder is it for us to have to get out of our communities, to go find healthy food, nutritious meals. And so I think that's really important as we think about social determinants of health and the communities that we live in. In regards to United Way and a lot of the work that we're doing, we try to, as much as possible, take a public health approach to the work that we're doing and really go back as far upstream, as you'll often hear, as possible, right? And we think of downstream as being the outcomes of health and the diagnosis itself. But how do we go back and further back to get to a place where potentially you aren't getting to the hospital or aren't having diabetes, hypertension, because you've gotten the education, you've had the environment. And so for us, many times here in our local community, it starts with, and it's interesting that it starts as early as 3rd grade in literacy. And for me, coming to United Way really put that pin in it for me, which is you can literally tell by the reading levels in 3rd grade, potentially the outcomes in regards to the job opportunities your child is going to have, whether they're going to graduate from high school or not, whether they're going to attain a college degree or go through a training program. And poverty is absolutely linked to our health. It is linked to our health. We just talked about social determinants of health and the environment and your zip code predicting your life expectancy. Even within my own town in West Sacramento, 2 zip codes, same exact city, and there's a 5-year difference between the north and the south of our town in our life expectancy. And if you compare West Sacramento to Davis, there's a 10-year difference in life expectancy. Your zip code literally matters, but why does it matter? And it's because of the environment. And it's because of things, again, like the education that you have access to, and again, the poverty that then is tied to it. It is the school to prison pipeline, it is all of those things. And so part of what United Way does in regards to social determinants of health, again, our mission is to end poverty, and so we do literacy tutoring in our 5-county region. We are in Elk Grove Unified School District, K through 6th grade. We are in Folsom Ranch, Cordova. We partner with the SAC Public Library. We partner with organizations like CHOC. And so whether your kiddo is getting it there at their school or in their housing complex, we'll partner with you to make sure your kid is able to read at grade level, because we know that switch from learning to read to reading to learn happens in everything, including math and science and all the things that are important. We also do guaranteed income because we realize just as important as it is for the child to be able to take that education, in order for them to be able to thrive and actually go to school not feeling hungry, knowing that when they go home, they're actually gonna have a home to go back to, right? A roof over the head. We provide housing supports. And so first, last month's rent, we even pay to get things off of your credit so that you can be leased up. All of those things are things we are able to provide. And I nodded to myself when you talked about the fact that Kaiser has been in this business of social determinants of health for decades, and that is so true. And one of the things I think we're very fortunate for here in California is that Department of Healthcare Service began to shift the way that Medi-Cal looks at health as well. And I think about it as more of the Kaiser model, quite honestly, which is this recognition that housing is important, is recognition that food is important, medically and nutritiously tailored meals. And now our healthcare system, Medi-Cal, actually provides for those things. You can bill for housing. I mean, really think about that. Your provider can bill for housing to get you housed. It is that important, and that it's that connected to your health care. And so United Way here in this region is working in all of those spaces. We also touched on the fact that United Way provides guaranteed income. And so in 2021, United Way was the first organization in the Sacramento region to launch a guaranteed income program, and it's exactly what it sounds. What is the easiest and best way to end poverty? You know what? Sometimes you just need money, right? You can only stretch, right, 15 cents into a dollar so far, right? And so it's not that you don't know how to manage your money. It's the fact that you have to work 2 or 3 jobs in order to actually address the real costs of what it takes to live in Sacramento, to pay for childcare, to pay for rent. And so United Way in 2021 launched the first guaranteed income program. In 2023, July of last year, we actually partnered with City of Sacramento to launch a guaranteed income program for City of Sacramento. 80 slots, $505 a month. We had 15,000 applicants for those 80 slots. There's that much need in our community. In this year, January, we partnered with Supervisor Cerna and Supervisor Kennedy here in Sacramento County because they saw that there was a need. How do you prevent folks from being unhoused? Research shows guaranteed income can prevent people from being unhoused. As we're trying to address the homelessness issue, for every 1 person you're getting housed, 3 more are becoming unhoused at the same time in this region. And so you have to turn off the spigot, make sure that people, again, aren't falling into becoming unhoused. And so we launched Guaranteed Income with Sac County. Sac County supervisors, all 5 of your supervisors last month actually approved a preventative guaranteed income program. $2 million, 200 families, $750 a month that will be launching for Black and Indigenous families this year.
That's awesome. So, sorry, that right there is what you call some Black girl magic for sure. Yes. So thank you, Dawnte, for all that you do. And, well, I have some questions for you later, but I want to ask Anita. We always say health is wealth, right? And so when we talk about what you do, or when you will talk about what you do, can you also talk about like how chronic diseases that impact our community also have an impact on the workforce? And any other perspectives that you want to share around that?
Yeah, absolutely. At SETA, we actually work on the continuum pipeline from early childhood education all the way up through the workforce pipeline. And Dr. Early, thank you for really making the argument of the linkages between poverty and the quality of life, because it really does matter, and access really matters. I'd love to start with a couple of statistics in terms of the poverty here in Sacramento and what we collect, so that to put a little bit more context. In 2023, Sac County residents earning less than $60,050 annually are considered low income. We have a poverty rate in Sacramento of 15.7%, with 9.7% of families living in poverty. Families with children 0 to 17 make up about 16.9%, and they fall within the income eligibility to qualify for the Supplemental Nutrition Assistance Program, otherwise known as SNAP. Of all SNAP participating households, 59.3% are with children. 98% of the children that we serve through Head Start, Early Head Start, has medical coverage through Medi-Cal. And SETA, very much like the United Way, we try to help families out, not only with preventative care, but we also serve as payer of last resort, where if they have no other way to pay for their bills, we will cover those bills for them. We work extensively with community partners and to promote that prevention, screenings and dental navigation for our Head Start and Early Head Start kids. And we try to, well, not we try, we follow the American Pediatric Society's periodicity table, Bright Futures, to ensure that all children receive age-appropriate immunizations, health screenings, examinations that lead to lead screenings. We work with pregnant women to make sure that they receive the proper prenatal care and preventative services. Children who are on IEPs, individual education plans, we provide services for them. And those children with disabilities, we provide speech and language impairment. And then there are lots of conditions that our young children are diagnosed with, asthma being the primary chronic condition prevalent in Sac County. It's the #1 medically diagnosed chronic condition among our Head Start and Early Head Start children. And other environmental factors include high air pollution, allergens, obesity, overweight, which is a big problem for the children that we see. food insecurity, access to parks and spaces, and tooth decay. In terms of the pipeline on the workforce side, we see and we know that socioeconomically disadvantaged populations really bear the disproportionate burden of chronic illnesses, right? And so we operate a series of job centers that provide really valuable connections and resources to vulnerable communities. And we serve a population that have pretty significant barriers in the workforce, including those with disabilities, underemployment, skills deficient, culture barriers, ex-offenders, homeless, and dislocated workers. So we know that racial gaps exist within those industries. In fact, I'm going to give you some more statistics because I think they're really jarring. 43% of Black workers are in jobs that pay them less than $30,000. There's an underrepresentation in the fastest growing higher wage industries, and Black workers have lower odds of advancement in the workplace. There are lower representation of Blacks in executive roles and lack of mentoring and sponsorships. The vast majority of employees who identify as being part of a marginalized group experience racism at work. We know that to be true. In fact, Pew Research found a study that cites that 4 in 10 Black workers have experienced racial discrimination or have been treated unfairly by an employer in hiring, in pay, and promotion because of their race or ethnicity. We know that marginalization has contributed to the public and population health crisis, and in fact, Sacramento declared racism as a public health crisis in 2020. So we know that low-income populations, those living in poverty, are the most harmed by the effects of systems and infrastructure, and really affects the well-being of their health. And it definitely is connected, and the linkages are there.
Okay. Thank you, Anita, for sharing all of that information. Thank you. And thank you, everybody. So I have some questions I want to ask the panelists, but I want to provide the audience the opportunity to ask some questions, or if you have some thoughts about what you've heard so far, don't be shy. Anybody curious about anything? There's a question in the back, yes.
Hello.
Yes.
Hi, everybody.
Much better.
Thank you. In regard to cancer, because it is just so prevalent, and I wonder about someone who may have the diagnosis, like what are the options if I'm in a situation where I'm about to be on, like the bills are piling and I need this treatment, but I don't have like transportation, or like, do you come across that, and then what can be done? Because, you know, the stages move quick, and then some people feel like, oh, if I just ignore it, you know, or, you know, some of the things we tell ourselves, I drink some ginger tea or whatever, and maybe that will help me. But like, what are the options if you know, and because it's scary.
Yes,
Right.
yes. And that's a real problem. And I can't tell you how many times I've personally thank God for the health care that I have, because without it, I don't know what I would have done. I can speak to Kaiser Permanente, and one of the things that we do is conduct what's called community health needs assessments. And so you can actually ask your care provider for programs. Are there programs that can support me? We have something called medical financial assistance, where we help people pay for their care. It may not be enough, but it is something that you can ask for and ask to be supported in that way. Part of our community health needs assessments look at everything from transportation, because how am I getting to the chemotherapy appointment, to food insecurity, to housing. They assess all of those needs. I can tell you today, I'm in a very different place than I was 13 years ago, because I kind of know what I'm doing. I figured out the system. But some of the things you want to look for are things like not only an oncologist, but you might also need a radiation oncologist that you're connected to. There are nurse navigators, at least at Kaiser Permanente, that help with the coordination of services. I can tell you even now, sometimes I get overwhelmed coordinating all of my appointments, and one of my CT scans might show a new growth in this area, or they're not sure what that is, or I'm having extreme headaches. One doctor might suggest, ooh, you might have a tumor on your brain. It's so unsettling. I cannot tell you all that I've been through in the past 13 years, but I've learned that you have to advocate for yourself. You don't just sit back and say, well, there's nothing I can do. Keep pushing until you get the answer that you need, and 9 times out of 10, there are some resources available to you. I currently have an oncologist, and then I've got Dr. Grennan on speed dial. Even though he's retired, he's never getting rid of me, or my mother. She calls him too. I also have a social worker assigned to me. I have access to a nutritionist. Although I am a certified nutrition health coach, I put myself through school to teach myself how to eat properly and live. But I also have access to a nurse navigator. And a palliative care doctor. So I have a team now that supports me, but that was me asking and then getting finally to a good doctor that referred me and connected me to those things. So I would just say, to answer your question, there are resources available. They're not readily available. We've got to change that, but open your mouth. Don't accept death or a diagnosis without fighting.
Thank you for that. And so, thank you. And just to add to that, there are lots of organizations and foundations out there that do provide support, financial as well as other types of support for cancer patients. So the Patient Advocacy Foundation is one resource. If you're going through a clinical trial and you're not able to get or afford your transportation to where the clinical trial is, the Lazarus Foundation actually provides financial support for your transportation. The Susan G. Komen Foundation also has resources and patient navigation support resources. So unfortunately, you have to do your homework and search and find and just ask, right? I say you don't get if you don't ask. If you don't ask, you don't get. So you got to do your own advocacy and find out what's available and do your homework. But I think going further upstream in this case is making sure that we are compliant with our annual cancer screenings. Now, so there's no cancer screening for your type of cancer, pancreatic cancer, that I'm aware of?
No, but the symptoms are pretty, I don't know. If I would think if I was a doctor and I heard these things.
You would know. You should know, right?
Should put 2 and 2 together. But that also speaks to the disparities.
Yes.
For some people, that may be happening. They may not be happening for all of us. So, yes.
And just to kind of comment on that, I did general surgery before doing vascular, and pancreatic cancer is not necessarily a cancer you see very often in African Americans, and it may be possible that they just
assume
exactly.
Yeah, because of what she looked like. Right?
Exactly.
Yes, unfortunately that happens and much too often. And so I also wanted to mention 2 other things, and if anyone in the room or folks that you know are on Medi-Cal, I wanted to mention that we were fortunate enough to be part of a coalition called the Cancer Care is Different Coalition, and also be part of the coalition that got SB 987, the California Cancer Care Equity Act, across the finish line, and it was signed into law by Governor Newsom in September of 2022. And so what that bill does is meant to address the cancer disparities gap for Medi-Cal patients who we see poor outcomes for. So there's definitely a disparity between Medi-Cal cancer patient outcomes and those with private insurance. And so what this new bill does is it allows for a Medi-Cal patient who has a serious or advanced or more complex cancer diagnosis, like pancreatic cancer, to get access to the standard of care, should that be appropriate, but also precision medicine, access to genomic testing, and then also to get enrolled in a clinical trial if all else fails, and that is the only other option. And so Christina here was in a clinical trial. We need to have more of our people and people of color participate in clinical trials. But just wanted to make sure that everybody in the room is aware of the California Cancer Care Equity Act too. And then also there's one other thing from a screening standpoint, and this is something that's happening more so in the Medicaid and Medi-Cal arena. There is a blood draw test called the Gallery test, and it's basically in the category of multi-cancer early detection. So now there's a blood draw that can be done that detects over 50 different types of cancers. Maybe not as good with hormone-driven cancers like breast cancer and prostate cancer, but for some of the other types of cancers that may not have a standard screening test, it could be a very valuable way to get more cancers detected early. So just two resources that I think are important to share. So any other questions from the audience? Yes, another question.
Thank you. Regarding food security, and I'm going to direct this to the panel, but specifically Dr. Early, because I know you do policy work as well. What can communities do to advocate? Because I had just learned this concept, and I don't think a lot of people knew it, but I feel like we know it intrinsically. The concept of like A, B, and C supermarkets, where depending on where you live, the quality of even the produce you receive is not up to par. You know, in our urban communities, they darn sure ain't gonna stick a Whole Foods in there because they're like,
Right, yeah.
but we still deserve access to that fresh produce. So what can we do to push so that we too can get, because we shouldn't just be limited to canned items or what's at the bodega.
So I'll start it off, but I'm sure my colleagues also have some thoughts on this. So I think there's a couple of things. When we talk about advocacy, now I'm going to put my city council hat on. I think it's important that we vote, just quite frankly. And your local city council has the biggest impact on your daily life. I know sometimes, right, you have high turnout for the presidential election and some of those other ones, but when you talk about your streets, when you talk about your parks, when you talk about judges, your police department, your fire department, all of those things, that's your city council. Much of the time, it's your city council. And what is being actually put into place locally to incentivize a Whole Foods in coming in, right? Do you have the infrastructure so that it's easier for businesses to come in to certain parts? Do you see the investment in regards to your budget in parts of your city that need it the most? All of that is who you're voting into office. And so at a very, very basic level, it's registering to vote. You can now register to vote at 16, by the way. United Way is also an ambassador with the Secretary's office on that. But also it's getting out and voting. So that's one thing. It's also, just quite frankly, the CBOs and nonprofits that are also coming and potentially providing opportunities so that it isn't just canned foods that you have available to you, which are also important, but having creative, innovative ways that you're partnering with Kaisers, that you're partnering with Setters, that you're partnering with Mercy, and having these public-private partnerships so that even if down the line you're going to make it happen eventually, what are you doing now that's possible in regards to mobile food trucks and other things that allow for you to have access to fresh food.
So before you move on, you mentioned one thing, and I think it might be important to explain what that is. You mentioned MTM, or medically tailored meals. Can you talk a little bit about what that is and how people can access and how that all works?
Absolutely. So, and I'll try to be short because I know I could be a little long-winded. It's the researcher in me. So a few years ago, DHCS changed what Medi-Cal can and is willing to pay for. Medically tailored and nutritiously tailored meals are actually one of the things that if you are a Medi-Cal client, you have the potential of your provider actually literally prescribing you nutritious meals. And so there are actually not a lot of CBOs or organizations, unfortunately, in our region right now that are able to meet this provider level. And I think when we talk about and it's not something necessarily that we touched on, but I know we had talked about before, just in regards to actually building CBOs up in your local community to be able to do that. I think that's really, really important, and that's where partnerships with Kaiser, partnerships with HealthNet, and some of these other health plans come into place. And it's exactly what it sounds like. Up to $12 a meal, 12 weeks of assigned nutritiously and medically tailored meals. So if you have hypertension, diabetes, right, some of the things that we heard, you can actually prescribe your patients meals that they will get delivered to their house.
For free.
Yes. Yeah.
Yes. Great. Thank you for sharing that. Sorry. Christina?
Oh, I know we only have 5 or 6 minutes. Just to piggyback here on what was said, definitely voting. Vote for people that care about the things that you care about. Vote for people that want to advance things that you care about in your community. That's how we create change. We at Kaiser Permanente, as was mentioned, offered those medically tailored meals. And earlier I mentioned the $2 billion that we invest in communities. One of the ways that we do that is around food security, and we do things like go into what's considered food deserts. These are places that you may be getting your groceries from the liquor store, the 7-Eleven. There isn't a Whole Foods, there isn't a Sprouts, there isn't, a Bel Air. There are liquor stores on certain corners, and that's where families are going in to get their food. And so we will make an investment in that community and do things like not only create bikeable paths and parks, but grocery stores. And we sometimes get pushback, like, what does Kaiser have to do with putting in a grocery store? Well, nutrition is everything. It's part of health. It's part of health equity. It's part of understanding what the social determinants of health are. And they are the basics. There are basic needs for food security and housing. So just want to echo that the vote is so critical. And again, raising your voice, asking about these resources that you and your loved ones may need.
Right. So it's not only important to advocate as a patient if you're trying to navigate through the healthcare system, but you also can advocate for what resources you want available in your community. So I think collectively amplifying your voice and showing up at city council meetings and knowing what to say, how to ask for what you need, and continuing to show up until your voices are heard and there's action taken. But I think, so just to reiterate, I can't stress enough the importance of participating and voting in state as well as local elections. I think, like you mentioned, we all think the presidential election is important, and we always say this is going to be the most important election ever in our entire lives, and I think this time that is actually the case. So getting out to vote at the federal level and state and locally can have a significant impact on your life, one way or the other, yes. Any other questions before we wrap up from the audience? Is there one back there?
Hi, how you doing?
Yeah.
Quick question. Talked about the meals and everything being covered. I wanted to know, is there any avenue, any way we can help? Because I know, because I work for one, I'm not going to mention which one, the insurance companies, they don't pay for the food, or they'll try any way to get out of it. So how do we go about fighting that? That's really my question.
That's a great question, but I know HealthNet, and I think, I'm trying to remember what other insurance company covers the medically tailored meals. Not all of them do.
So a couple of things,
Yeah.
and I'll try to be short, and then we can talk afterwards if you would like. But so the way that CalAIM actually works is that you have CBOs, organizations that actually contract with your local health plans. Here in Sacramento County, just as an example, but across the state, different health plans are actually Medi-Cal approved health plans. In Sac County, you have Kaiser, Molina, HealthNet, Anthem, Blue Cross. Did I get it right? I'm almost positive those are the four now, because this year we had a change and we went down one. So what I would say, I'd say a couple things. As a CBO, it can be part of the hard part that has been with CalAIM is actually the upfront cost for organizations to be in a situation where they can actually do this work. And so when we talk about advocacy and what you could do, a lot of that is advocating at the state level to put in seed dollars so that organizations can actually build up for this. I'll give you an example. even though you could be giving medically tailored meals and billing for that, you actually have to wait to be reimbursed for that. You also have to have the back office to be able to bill health plans, and that means denied claims, going back, submitting different claims, right? And so a lot of that can be burdensome for organizations and CBOs. And so when we think about local organizations, particularly local organizations that are from the community, run by the community, that can be one of the barriers to actually even getting started with something like this. So that would be, I would think, thing one. The other one is working with CBOs that may already be doing this and doing technical assistance and shared knowledge, because many, what I have found here in Sac County at least, organizations that are doing CalAIM and these various activities are more than willing to share and provide technical assistance.
Okay, great. So we have 33 seconds left. Anything that you think would be important to leave with the audience that hasn't been shared, or just to reiterate and reemphasize a little bit more as a takeaway, very quickly? Dr. Keith.
No, I think there have been a lot of important points made already. I would just say be an advocate for yourself. Find you a health physician that's very invested in you. And again, I hope you guys don't have to see me ever. And I think a lot of that is going to be due to eating right, working out, taking care of yourself.
Yes, I would quickly say two quick things. One, ask yourselves, how am I doing in terms of educating my loved ones, the members of my family and myself, about health care and taking good care of myself and my family? That self-accountability piece is critical. We don't want to end up in the doctor's office or on the operating table or with a cancer diagnosis. So ask yourselves also, what changes do I need to make? And every small step is a step in the right direction.
I would just say invest in your community. You're advocating not only for yourself and investing in yourself, but investing in your community. That means local nonprofits, as well as your local elections.
And Anita.
I would just leave you with a happy employee is a productive employee, is a healthy employee. So as an employer, if you have a toxic work culture, you need to work on that. If you're an employee in a toxic work culture, try to find ways to either manage your stress or get out.
Great. Thank you very much. Let's give a round of applause for the panelists. Thank you all very much. I would be remiss if I didn't mention one thing. So as the California Black Health Network was very fortunate last year to work with the California Legislative Black Caucus to get a resolution passed to declare the first week of May as Black Health Equity Advocacy Week. Here in California, we were the first in the nation to do it. Washington State now has one, but we were the first. So next week is Black Health Equity Advocacy Week. It's an opportunity for all of us to amplify our voice and bring greater attention and awareness to the need to address what is happening in our communities, whether it's at the individual level, community level, or system level. So if you follow us on social media, you'll get to see all the things that we're doing. You can repost, you can tell everybody else about what we're doing, and the need for our community to be more engaged in solving our community's problems and taking more control and being proactive about our health and wellness, because it all starts with us. Ends with us too, but definitely starts with us. So thank you very much. Okay. And have a great weekend.